Most people don't know these 10 ways to protect yourself and your loved ones against COVID, recommended by the World Health Organization, and how we can all help stop our outbreaks. I am not an expert, just sharing the good information as recommended by the World Health Organization. Please be sure to check any YouTube blogger's advice against reliable sources. Check out this blog post in the video description and then go to the links to find out more. 1. Most people don't know to isolate from their own household and that you can still protect your loved ones if you develop symptoms of COVID. You may remember this video of how Li Ting, an emergency room nurse, looked after his wife at home in Wuhan. This disease hasn't changed. Designate your least vulnerable household member to look after the COVID case and look up the World Health Organization advice. A health worker wouldn't dream of looking after COVID cases without taking steps to protect themselves from the disease. You shouldn't either. This disease spreads in rare, super-spreading events, even in households. Even if you already have symptoms, if your super-spreading event hasn't happened yet, you likely haven't passed it on to anyone yet. From a Princeton University-led cluster investigation of 500,000 people in India, 7 out of 10, or 71% of COVID cases don't transmit it to anyone, and most of the transmission is from less than 1 in 10, 8% of the cases. If you have just developed symptoms, even your partner, spouse, child or parent likely doesn't have it yet. You most likely haven't transmitted it to anyone, but still can, and can stop any future superspreader events by isolating. 2. Most people don't know the emergency symptoms for COVID. Learn the symptoms and get an oximeter and contact emergency if your oxygen levels fall. Remember Trump. Trump whisked to hospital in a helicopter as soon as his oxygen levels began to fall. If you get symptoms of unusual breathlessness or low oxygen levels, or blue lips or face, or heaviness in chest or confusion, or difficulty to arouse with COVID, ring emergency help right away. You probably won't be whisked away in a helicopter, but they are likely to send an ambulance. This usually happens 4 to 10 days after you first show symptoms, if it is going to happen. A quick response with medical oxygen and starting on dexamethasone right away saves many lives. You can home treat the symptoms, but can't home treat lack of oxygen. Many survive breathlessness at home. However, sadly, many have died trying, and all those lives could have been saved. Most people don't know that soap and detergent are our best weapons against COVID. This virus is covered in lipids and attracts soap molecules. They act like miniature crowbars, split it open, and the virus basically explodes. Alcohol hand rub works well too, but soap is the best choice. It is easy to clean surfaces and your hands. Just one touch of soap, the virus is gone. The main thing is to be thorough. Learn how to wash every part of your hand, following Dr. Tedros's example, and it can be gone in seconds. Most people don't know that you should quarantine away from your household right away, without hesitating, as soon as you know you are a contact, and this is the best way to protect your household. If you are a contact, the disease may already be in your body, but in such low numbers it can't be detected and can't infect anyone yet. It is too late to stop the disease in yourself, but you can stop it getting to anyone else. It is usually a few days before you develop symptoms, and often over a week. You are most infective in a couple of days before the symptoms, through to a couple of days after. If you quarantine as soon as you know you are a contact, you are most likely not yet infectious. That's Mike Ryan's golden wish. For us to do isolation and quarantine properly. He doesn't think any of us in Europe are doing this systematically. Let's listen to him talk about this.
Let's be plain and honest here. if you are a case or you're someone who's positive, you should be at home in full isolation or in a clinical care facility. If you are a contact of a case, if you know yourself to be having been in contact with the case, you should be in full quarantine at home without contact with other people, or in a third facility and without contact with other people. And that is not so as to imprison people, that is so as to break chains of transmission. If we're seeing transmission now at community level, and then we do big major lockdowns and we push that transmission back into the household, and what we're seeing in many European countries and North America is that a good deal of transmission is occurring at the household level. So it's gatherings at home that are doing a good deal of the transmission. So even if you end up with a societal level lockdown and people continue to gather in those environments, we're still going to promote and continue transmission. So countries are facing many dilemmas right now. But for me, if I get a chance or a golden wish to improve one thing that we could really, really improve and change the game here, apart from all of the other advice about using masks and physical distance and asking that people can stay the course, and it's tough. But if I was being asked, as a public health physician, if I was asked for one thing that could improve, that might change the game here, that is making sure that each and every contact of a confirmed case is in quarantine for the appropriate period of time so as to break chains of transmission. And I do not believe that has occurred systematically anywhere, and particularly in countries that are experiencing large increases now. That has been very hard to sustain over the summer, and I think a good part of the reason why we're seeing such high numbers at the moment.
So I just want to supplement that because
so especially as we're going into isolation, into lockdown, then it's especially important it's being driven into the households by doing that, and we need to isolate and quarantine at home. So look at the WHO advice on how to quarantine away from others in your household. Most transmission, 80%, is within households, and we can stop nearly all that if we isolate and quarantine properly. The outbreaks would go down quickly if we all did this. If you are contact, you most likely don't have it. Typical figures are 1 in 40, or if in the community, increasing to 1 in 11 in the household. However, you quarantine to protect them in case you do. The main reason we are often in lockdown in Europe is because we are not doing this quarantining systematically. Most people don't know you can do your own contact tracing. Don't wait for the contact tracers. If you have COVID, ring up or text or email anyone you are in contact with starting 2 days before you develop symptoms. It doesn't mean someone you shared a park bench with, but someone you spoke to close up without physical distancing for 15 minutes or more, or lots of short contacts with the same person adding up to 15 minutes in the same 24-hour period, or other very close contact. The people you have very close contact with are top priority. And this diagram shows how it works. If one step behind is the isolating, you will stop some of the transmission that way, because most of us won't have passed it on to anyone. But there's still a possible future super spreader events. And so the ones in the future you can stop, ones in the past you can't stop when you home isolate. But the one step ahead, if you self-isolate when you are in a close contact knows they are infected, then that's very effective. If you do this quickly, they may not have passed it on to anyone yet. Unlike flu, most of the contacts will be people you have the phone numbers of already, or you know how to get them through a boss, event organizer, etc. You don't need an app for most of them, except to jog your memory. Most people don't know how effective good habits such as physical distancing are. It is like looking both ways when you cross a road. Your risk of a traffic accident is nearly zero if you do that, and it is the same for COVID if you physically distance. The virus mostly spreads through larger droplets, These travel in seconds to the other person, inside or out. Ventilation helps if you are indoors, but it doesn't protect you if you talk face to face within 1 meter of someone. Also, you don't need a mask if you physically distance with good ventilation. Let's look at this one. If you only do only one thing to protect yourself from COVID-19, do this. When talking, laughing, coughing, singing, stay 1 meter, 3 feet apart, winter, summer, indoors, outdoors. More than 1 meter, 3 meters apart. And this shows how the droplets go from your mouth, and they are going under gravity. They're heavy enough, although they're too small to see, they're still heavy enough to be travelling under gravity. And you don't expel them fast enough for them to go more than a meter or so. So in this case, Maria Van Kerkhove and Mike Ryan are far enough apart so they can't infect each other. And so they don't need to wear a mask. In a good ventilated room, you can see it's a big, well-ventilated room. The WHO say 1 meter, some people say 2 meters. The main thing is to step back and to be at least 1 meter away. Most people don't know that you need a lot of virus to get infected. With some viruses like adenovirus or H2N2 flu, nearly everyone will be infected if just one virus gets into your body. In this table, 0.5 is the number of viruses it takes to infect half of people. If it's 0.5 means that just a single virus will infect anyone. But for COVID, several hundred viruses are needed for a reasonable chance of success. This is why close contacts matter so much, while a few viruses on packaging would not affect you. Many people are very anxious about packages they get through the post or in a shop, or people they pass in shops close by. But don't think anything of talking to a friend out of doors for 15 minutes without a mask and without physical distancing. It should be the other way round. There's currently no evidence that people can catch COVID-19 from food or food packaging. COVID-19 is a respiratory illness, and the transmission route is through person-to-person contact and through direct contact with respiratory droplets generated when an infected person coughs or sneezes. That is their answer to the question, can I get COVID-19 from food? The answer is no. There's no evidence that you can catch it from food or food packaging. Many of the people I help wash their food packages when they get back from the shop. There's no harm in that, but risk from them is about zero. I wash them myself, but just for the first day after shopping. Most people don't know that you can avoid COVID fatigue using automatic habits. It's like learning to ride a bicycle or tie your shoelaces. Make it automatic and it's much easier. Read up the proper instructions on how to wear and use a mask and make it all a habit. For instance, never touch the front of the mask after you put it on, and keep it in a bag or envelope when you take it off. Follow Dr. Tedros' video that I just showed up there on hand washing and copy it several times until it's habitual. And these are all examples of what you should do to make it automatic. Follow these things. Do like learning a musical instrument. Then learn how to do it and repeat it until it's second nature. Always step back when you socially interact with anyone except your bubble. If you're quarantined or isolating, always step back, even from everyone in your own bubble. You get COVID fatigue if you're constantly having to make decisions about how much distancing to do, then eventually you'll probably give up. If you always do the same thing, it's much easier both for you and for everyone you interact with. They get used to you as a person who steps back, even if they're not doing it, and hopefully eventually you influence them. In this way, you can keep this up until it's all over, and then we can all celebrate. That's it. When you interact, step back, not forward. Just always do that. And it needs to be automatic like the highway code. Just like you may cross the road many times during the day, and you always look both ways. In the same way, you interact with people socially many times during the day, always step back. Just automatic like that, just like you do with the road, crossing the road. Most people don't know how random COVID is, or about long COVID. If your friends get COVID and it was mild and nothing happened, it does not mean you are safe. Most people get it mild. And this is my graphic. COVID-19 is the leading cause of death in the US. If you are infected and over 90 plus, your risk of dying is similar to Russian roulette. If you're young and your risk of long COVID, sick for months on end, is like Russian roulette. Most people survive Russian roulette. Do you want to play this game with your life and health, or wear a mask and physically distance? For young people, a fit young person able to run up mountains with O positive blood, which is a slight advantage but it's not as much as people think it is, can still get COVID. None of that makes you immune. If you win the game of Russian roulette with your health, nothing happens. If you lose the game, you could be in bed for months, too fatigued to do much. Even young adults over 20 have an appreciable risk of dying, similar to your risk of a traffic accident. It is worthwhile taking care when you cross roads, and it is the same for COVID. For the very young, under 20, this risk is close to zero, but you risk passing it on to your children, your household. For the very elderly, especially over 90, it's like Russian roulette with your very life. And if over 50, it's a very significant risk of dying. Most people survive Russian roulette, but it's better not to play. And you may well have friends who have survived this Russian roulette with COVID-19. If you've got a few friends who have had nothing happen to them, this does not mean that it's safe to you. The risk is still the same as Russian roulette, even if you have several friends who have managed to survive this Russian roulette with COVID-19. Instead, you can become a superhero in your community with your toolbox of all these ways to protect yourself and others from COVID-19. So you have COVID-19 toolbox, face coverings, learn to do them properly and make it a habit. Contact tracing, you can do your own contact tracing. Physical distancing, and just make that a habit, just step back. Vaccination, when it comes, we add to the toolkit. Quarantine, then then again, isolate properly when you quarantine and isolate properly. The hand hygiene, and wash your hands properly. Mass testing, that's up to the government, they do that. And then stay informed. And so do check things like this. Don't just take it that because a random YouTuber tells you that you've got to do something, that's how to protect yourself from COVID. You know, they may say things that will make you comfortable, but it's not necessarily going to be helping you. So be sure to check against the good advice from the World Health Organization, or if it's the World Health Organization themselves giving a video, or someone else who's obviously expert, Dr. Fauci or something, one like that. So few governments are following the World Health Organization recommendations on test, trace, isolate, quarantine, but we can follow them and help protect our own communities. The World Health Organization advised that where possible, countries should offer quarantine in separate hotels. And then, as Mike Ryan said in that quote, that's the best. And then you have zero risk of passing it on to your household after quarantine starts. Not forced, but an offer, so that you can take it up. And they also advise them to isolate all confirmed cases in separate wards, hotels, or community centres. We shouldn't be isolating at home if there's any possibility of isolating in a ward. And if that's not possible, or a community centre, if that's not possible, then a health worker should be coming and advising you and look over your household and advise you how to home isolate. Sadly, very few countries are doing that either. So few countries are doing these things. And a health worker should be phoning you every day if you've got COVID-19, checking up on your progress, asking you about symptoms, and checking out that if you need help and so on. But if you're COVID aware, you can do much of this yourself. You can also help others if they're quarantining and they need food and so on. And do your part to help stop the spread, at least in your own community. If you do these things and you stop the virus, don't do them, and you might become the index case of a new outbreak in your community. So you have that choice to stop it and not let it come to you, or once it gets to you, stop it and not let it get to anyone else. If it comes to you and then you've got contacts, help them to stop it. And if you don't do any of those things, then you're likely to become, you have a small chance. It's not a very high chance, but if you're that 1 in 10 who super spreads, then you can be the start. And it's not a very small chance, it's quite significant. You could be the start of the outbreak in your own community. And it could be spreading all through your village, town, your central area, and just because of you. Future looks good. They will be vaccinating tens of millions and eventually billions by spring through to the summer. Vaccine alone can't stop the virus until many are vaccinated. But 20% of the world is already virus-free without a vaccine. And this is an article I did about that. And you see how quickly it dropped in New Zealand. And that was the result of just without a vaccine. New Zealand did that without a vaccine, tenfold reduction in 25 days. And if we all do these things, we can bring it right down without a vaccine. And then if we keep on doing it all the way down, once we're 1 in a million cases, we should keep doing it. And we won't need a lockdown, and we can end up like that. And in the case of Taiwan and many parts of China, they got all that way without a single day of lockdown. Only in Wuhan, Hubei province, and nearby regions did they have lockdown in China. Even the US and UK have rising cases per day because we now know of typically 1.25 or less. This means that stopping a sixth of the remaining transmission is enough to turn it around so cases per day fall again. We could turn it around through applying the public health measures rigorously and systematically. Or we can continue what we're doing, and then even a few percent of vaccines strategically used might let us reduce transmission by a few percent. So we can expect sometime in the middle to late spring that we'll have enough vaccinated so it's coming down quite fast because of that. But even before then, the vaccine should greatly reduce death in the elderly and in frontline health workers. Again, because there's 1 month delay for the vaccine to take effect, and then another because for the second dose, then another month before the deaths happen. If you could do the protection now, though, even if you're vulnerable, you do the isolation. You should still be isolating. You should still be quarantining. You still do physical distancing if you've been vaccinated, and do that now, and you are saving a month from that because your vaccine doesn't really key in till a month from now. Even once you're vaccinated, keep on doing this because the vaccine stops 1 in 20 of transmission, but in the phase 3 trials, 1 in 20 of the people vaccinated still got COVID. So you're not totally immune. It reduces it, works by reducing the deaths, reducing the risk of infection, and it hopefully, and I think there's a good chance of this from the preliminary data so far, it also stops transmission. And it looks like, especially Moderna, they've got quite good evidence that it stops transmission to others. And if that's the case, then vaccines are going to be really helpful as we vaccinate more and more people. And then if you can get down, if you can have the 1 in a million with COVID, then you just have little super spreader events. You can vaccinate an entire city of, say, 100,000 people, and that'd be only 0.5% of your country's quota. So if we can bring it down until the very few cases, then we can stop it very quickly with vaccination. We don't have to vaccinate everyone if we bring it down without vaccination. If we can bring it down like New Zealand or Australia, we could get rid of it very quickly with the vaccine. So anyway, that's it. But so do these things and you will be a superhero. And just remember, do it all, and do stay informed and check the good information. Check with good reliable sources like the World Health Organization or the US CDC, people like that. So that's it. Do check the video description for the article that I wrote, that I was reading from, and that's it. So I'll now upload this to YouTube and hope this was helpful. Even if just a few people, and do spread the good information, not just stay informed, spread the good information. If just 1 or 2 people listen to you, that's another extra people. And if you can spread it to 2 people, and they spread it to 2 people and so on, then this can go viral. Good information. Make sure that you share the good information with the World Health Organization with people you know so they also can protect themselves. And if they don't know these things, they should know these things. Everyone should know these things. And our government, sadly, in the United Kingdom, our government is not doing a good job of making it clear this. I haven't had a single thing through my door, for instance, explaining any of this. I only know about it because I follow the World Health Organization. To be sure to spread the good organization, the good information, help your government. Help your government to make sure that this good information spreads widely and we stop the pandemic and we stop our outbreaks, bring it right down, and then we stop it quickly with vaccination much faster if we do this as well. if you do at all.